Hey guys, it's Quinn again. I'm here making my next transition-related video. As of December 21st, I have officially been 1 year post-op. So that's what this video is going to be about. I am going to talk about what top surgery is, what the requirements are, what you should expect, things like that. Questions that people have asked over the last year, and try to cover most of the basics. If you guys have more specific questions, you're always welcome to comment, message me, whatever. But this is kind of what my experience was. So the general requirements for top surgery in general is that you have to have 2 letters, one of which has to come from a therapist. So generally people get one from their primary care physician, and people get one from a therapist. The therapist can be difficult to get. A lot of therapists are going to say that they're not comfortable writing a letter like that, or some of them will kind of skirt away from it by saying, I'm not qualified to write that letter, which is a load of crap because you don't have to have specific qualifications in order for the letter to be acceptable. You just have to be a therapist. But it can be hard to find someone to write you that letter. For me personally, I was in Pennsylvania when I was working on getting mine. I was actually staying in Westchester, which was like 45 minutes outside Philly. Luckily for me, there's a place called the Mazzoni Center in Philly, which is this really big, specifically LGBT-related clinic. And they have therapists there for basically this exact purpose, is for things that are specific to LGBT therapy. So I went and I saw this therapist and I told her, look, I really need my top surgery letter. I'm trying to get it by this specific date. I need to get this done. And she worked with me in order to make a schedule that would work with mine. And I ended up getting my therapist letter in just over a month, which was amazing because she was specifically dedicated to do that for me. Another thing that you have to have in order to meet the requirements for top surgery is, as per most insurances, you have to have a diagnosis of gender dysphoria. But in my experience, you had to have that gender dysphoria diagnosis in order to bill your insurance so that they would cover the surgery. So as far as the steps go for top surgery, there's a few steps, a few things that you need to do in order to actually get it to happen. First thing, obviously, you have to get your 2 letters. Once you have those, you get a consult with whatever surgeon you've decided to go with. For me, I went with Dr. Kathy Rumer in Philadelphia. She was amazing. Absolutely love her. But with her, the consult was $100, which can be difficult for some of us struggling for money. But she allowed me to not drive 3.5 hours from where I was at school to Philly. She let me do a Skype interview in order to do my consult, so I could ask her questions, and she could answer mine, ask her own questions, let me know how the whole thing went. And we did the whole thing over Skype, and it was perfect. Some surgeons don't offer that option, so you have to go see them. But first step is a consult. After you get that done, then you have to deal with your insurance. So getting them to pay properly for your top surgery can be difficult. Some insurances simply will not do it. Some insurances are going to make you pay out of pocket for it. I'm lucky. In my case, I have Pennsylvania Medicaid. So in Pennsylvania, probably 6 months to a year before I got my top surgery, there was a law passed that said that Pennsylvania Medicaid has to cover trans-related medical expenses. So for me, being on Medicaid and making as little as I had made, that meant that the actual surgery itself was going to cost me nothing. While this might be a little controversial as far as people saying that Medicaid shouldn't pay everything and that they shouldn't have to pay the taxes to go to Medicaid and blah, blah, blah. It's it was amazingly helpful. I didn't have to pay anything out of pocket. My wonderful friends at Williamsport Spectrum Alliance held a fundraiser for me to get some of the funds that I did need, because there were things that I did have to pay for. The program that I went into with my specific surgeon, she has a recovery program where you stay up to 7 nights in her recovery suite after you get your surgery, so that you're closer to her, you can ask questions, you're in one specific place in a bed, you don't have to deal with traveling to wherever you're from. So that was an option. It was $100 a night. So I stayed there for 3 days, and that $300 came out of Spectrum's fundraiser. And then there were little things, little pre- and post-op expenses that I had to do that probably totaled maybe $50. But they helped pay for that because they were amazing and did this fundraiser for me. But anyway, once you get it through your insurance, when they finally approve it, because it can take quite a while, that's when you set a date. So you're going to call your surgeon, figure out when it's actually available, and set your surgery date. At that point, there's not a whole lot you're going to do until right before surgery. Some people have quite a long wait. Some people get in really quickly. For those of us that have longer waits, there are some things that can be done in the meantime. Those of us who are not thin often may want to lose weight before surgery. One of the things that can happen during top surgery is something called dog ears, which is a section of your underarm over here kind of sticks out after surgery and makes this like awkward fold thing, which I'll show you in a minute. The thinner you are, the less likely that that's going to happen. So those of us who are a little bigger, who want to avoid that, may try to lose weight in the meantime before top surgery. Then right before top surgery, you got to get your supplies. So absolutely vital is loose, comfortable, button-down shirts. It needs to open in the front. That is extremely important because you're going to have very, very limited range of motion. You're not going to want to move. You don't want anything constricting. Trust me, you need button-down shirts. You're also going to want gauze, neosporin, probably some paper tape, and my surgeon specifically asked me to get Arnica montana, which is a anti-bruising, anti-inflammation tablet that you put under your tongue, and it helps prepare and help afterwards with your scars, it not bruising, it not swelling as much, and it's an all-natural thing. Super cool. Not all surgeons recommend it, but mine specifically did, and I think it's a great idea. My surgeon specifically had me do pre-op photos. The day before my surgery, I went into her office and they took a photo of my chest so that they could have comparison photos to the pictures that they took right after surgery and the ones that they take at my year update appointment. So that was cool because I was like, oh my gosh, this is the last time I'm going to have to deal with taking photos and being worried about my chest. It felt amazing. But the day before surgery, obviously with any surgery, you're going to have the whole you can't eat past blah 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 time. So you need to be prepared for that. Surgery itself, I want to say it took 2-ish hours from start to finish. Maybe. I'm not quite sure. But they strip you down. I wasn't even allowed to wear underwear. It was ridiculous. I was so uncomfortable. They put me in 2 gowns, and I couldn't wear underwear, and they made me take all of my jewelry out, and I was really annoyed. But you get completely stripped down, just your robes. They put you on the bed, cover you up in a whole bunch of blankets, and you get back there, and I vaguely remember them giving me, I want to say it was Tylenol. It was some sort of something to help pain. And then they brought me into the room, had me scoot onto the actual operating table. And after sitting down on that, I don't remember anything until I woke up in the recovery room. It was a weird experience waking up from anesthesia. I had never done it before other than my wisdom teeth. I felt really loopy and out of it, but as soon as I woke up, I just had this moment of, did this really just happen? Am I dreaming? Is this real right now? And it didn't really hit me until the first time I had to drain my drains. I was like, oh my gosh, this is actually happening. Whoa. But when you come out of surgery, they have gauze placed over the incisions. There are tubes coming out of your chest that are attached to these little containers that will fill up with blood and other fluids that you have to drain for the first week. After surgery, they'll have these drains on and you have to keep dumping them out. And then after a week, you take the drains out and you get to see your chest. That moment is amazing. For some people, it's this hysterical, crying, sobbing, oh my god, I'm so excited, amazing moment. And then for some people, and this is the category that I fit into, it was more of this huge sigh of relief. And then after about 5 minutes of looking at it, it just felt natural. I wasn't screaming with joy. I wasn't over the moon or anything like that. I was really excited, and I was so glad that it had happened. But it was more of a calming effect than it was a upping excitement. So it depends on the person with that. But after surgery, after a week, they take your drains out, you get to see your chest, but they're going to put the ACE bandage back on. That keeps it compressed, it keeps it from swelling more, keeps everything intact and in the right place, and things like that while it's healing. Most surgeons are going to suggest that you wear the ACE bandage for a month. Not comfortable, but it's ACE bandage for a month, no exercise for 6 weeks. That's how long the recovery is. They obviously give you pain meds after surgery. They were strong pain meds, and I want to say they gave me enough for 10 days, maybe 15. I didn't need them all. It didn't hurt that much to need all of the pain meds that they gave me. Honestly, the surgery itself didn't hurt very much. I was sore from it. The incisions themselves were slightly tender. But if I'm dead ass honest with you, the thing that hurt worse was the ACE bandage. It dug into me, it was compressing, and I actually still have a scar, obviously from the surgery, but I also have a scar from the ACE bandage itself that I'll show you guys. So yeah, that's basically what the recovery is. I felt better after getting my drain out. I felt normal after 2 weeks, and then you just have to slowly get your range of motion back. So you're not able to lift your arms past here for the first 2 weeks, and then you can slowly start getting your range of motion back until you can lift your hands. Now, what I need to impress upon other trans guys that are pre-op right now, do not raise your arms before they tell you to. I was stubborn and I did it anyway, and now I have stretch marks on my chest. Don't do it. As annoying as it is, as much as you think you can do it without it hurting, just don't do it. But yeah, let me show you. So this is what my chest looks like now. Here are the incisions. They go all the way from under my arm to the center of my chest. So what they did is they cut here and took quite a bit of breast tissue out, took my nipple off, and sewed this down, and then replaced it in a position that was more masculine. So that's what it looks like on each side. It comes all the way up there. But the dog earring that I was telling you about is this, how it kind of sticks out like that. That's because of me being overweight. So that happens to some guys. It sticks out like that, the little mark there. But I think it's the side that has the scar. Right here. That's from the ace bandage. It dug into me so much that there's actually a scar there. But yeah, so that's my top surgery experience. Some guys have different experiences, obviously. Not all surgeons are the same. But one of the questions that I've gotten is, what type of top surgery is better for each person? And that's not something that I can really tell you. There are a few different types of top surgery. The most common is what's called a double incision, and that's what I got. It's an incision underneath each of your breasts, and they replace your nipples in a more masculine position. That is for average to very large breasts. There's another option if you have very, very small breasts called keyhole or periareolar incisions. And that's when they literally just go around your nipple, take everything out, and put it back, basically. But that is only for, I want to say the max is an A cup. Like, I want to say around a B is where they cut it off. So you got to really, really small chested in order to get that one. That one generally doesn't look like you had anything done because it's just right around the edge of your nipple, so there's not really much scarring. Another question that I've gotten is, what are things that I should be prepared for as far as top surgery? And the things that surprised me were the pain of the ace bandage. I did not expect that. I just expected it to be tight, but it hurt. It was constricting, it like dug into me, obviously, where you saw, and that was very uncomfortable. Your chest itself is going to feel really tight, and you're probably also not going to have much sensation in it. So that is a really foreign feeling, not being able to feel anything on your chest. Just in the last, I want to say 2 months, have I gotten feeling back in this area right here. I just couldn't feel it. Another thing, most people lose sensation in their nipples, which for some people really stinks. But I haven't heard of many trans guys who get double incision that retain a whole lot of sensation in their nipples. So that's something to be considered. And the other thing is the incisions itch just like any other cut. I didn't expect that. It made me really uncomfortable because of the tightness of the ace bandage and then it itching underneath. But honestly, that's just about it. I mean, be prepared for that chest reveal. It might not be as crazy of a reaction as you expect it to be. But other than that, it absolutely saved my life. I can't tell you how absolutely thrilled I was after getting it done. I feel 1,000 times more comfortable in my body. I walk around shirtless all the time, which I was so excited about. I never thought I'd be that comfortable in my body to be able to do that. It feels amazing to not have to deal with putting a binder on every morning and readjusting your chest in your binder all the time and making sure that you're wearing clothes that don't make you look too chesty and the way you hold your shoulders, because most trans men hold their shoulders very forward so that our breasts sink inward. So I don't have to do that. I can actually relax my shoulders now, which is nice. But yeah, that's basically my top surgery experience. If you guys have any other questions, comment them where I post this. I will basically answer anything. You guys know I'm an open book. Thank you for watching, and I'll talk to you later.